Hi, you're highly welcome back to the channel, to our channel. My name is Amarachi and this is Amarago TV. So yes, today is story time, is gist, is my testimony, is my story, and I just want to share it with you because of course you're part of the family now. I've shared the pregnancy videos with you, and now I'm about to gist you the main gist, like the peak of it, the delivery experience of a first time mom. All right, so the pregnancy journey and all that, I think I'm going to talk about it in a different video, but today's video is all about the 4th of January, the day of my delivery, the day that I went into labor for the first time and I pushed out a whole human being. Like sometimes I look at her, I think we're 2 months now. Sometimes I look at my baby and I'm just like, oh, wow, I'm just amazed. So this is what grew inside of me. Like God is an amazing architect. He's an amazing designer. Ah, we say these things, but then feeling it and experiencing it changes the game. All right, so my baby came pretty early. I think we were 36 weeks at the time my baby showed up. Yes. And prior to that, while I was pregnant, I got into birthsafe.ng. It's a class or a forum or a platform for pregnant women where you can share your experiences, learn from each other, and it is hosted by Dr. Idara. So I found them on Instagram and it was a game changer. Like things that I was never taught in antenatal classes, I was able to learn them there. Antenatal, especially when it's a public hospital, antenatals can be quite ridiculous. Like they just push things onto you without giving proper explanation. So the information was more often than not half baked. But being in that in the bedsafe.ng forum, I got to know why I was asked to do some things. Okay, you're asked to take these drugs. This is the name of this drug. This is what it does. This is why you should take it. This is why you should do that. When you know why you are doing something, it's kind of broadens your insight towards it and improves the experience that you're having as well. So yes, and in bedsafe.ng, we are advised that when you get into your 36th week, that's your 9 months, you should start doing, there's something we call the NIL protocol. We learned about fetal weight control to control the weight of your growing baby so that your delivery experience will be smoother. We advise that instead of you having a very large baby that would make your birthing experience complicated, it's better to birth a small baby. But once the baby comes out, the baby is going to eat and the baby is going to grow. In 2 months, 3 months time, the baby will be fat. So the week before my delivery, I started doing mild exercises like taking really long walks and all that. I started, there's just, I feel like as a woman, you would know. You would just know somehow. Somehow, I just knew that my delivery date was coming close. Even though the dates that the hospitals and the scans had given me were still, even from my calculation, my LMP, they were still far. They were still like 2 weeks or 3 weeks ahead. But that's week, that's last week of December, first week of January. Somehow I just knew that baby was going to come. So I'll tell my husband and he'll be like, won't take me seriously. He'll be like, your date has not yet come another. So I started getting my baby things ready. I packed the hospital bag. I washed my baby's clothes. I started putting things in order. Like I started nesting. That's what it's called. Yes, I started nesting. I kept going on walks in the night after eating. I would go on walks. At the point I even started sporting. I know that on the 1st of January, that was the day I went to OOPL and made this video right here. So if you've not seen this video, you definitely should when you are done listening to my story. So that day we waka and so after all the waka now came back. That was 1st of January. 2nd of January, I continued, I would eat fruits, I would eat pineapple, I would eat dates. I was just up and down everywhere. I was just not serious exercises or I just kept myself active. Yes, I just kept myself active and I kept the movement going. So on the 4th of January, that was the day. Like I just woke up in the morning and I felt some kind of pain. From my sleep, I was feeling some kind of pain. I won't term it as pain. It's not like menstrual pain. Not just a day knocker. They're just like a feeling of when somebody pinches you somewhere. So that was what I was just feeling on my lower abdomen. So at first I didn't take it seriously. I say, maybe it's something that is normal. But then I observed that it was coming within a period of time. Like it will come a little time, it will happen again and again. So I just kept bearing it. I kept bearing it. My brain had not even clicked that you were born today. I started timing the contractions. This was around 10 in the morning. I started timing the contractions and I saw that it was 10 minutes apart. It was coming 10 minutes apart. But it was not that serious. Like it would just come and I will like get the pain and then it will go. So it continued throughout that day. Towards evening, it started getting longer and more painful, and then the period in between was now shorter, like 5 minutes interval. So I called my husband to come home quickly, and then at first we were not even sure. I was thinking, what if it's false labor? What if like there were a lot of what ifs? So we headed for the hospital at night, around past 7. We headed for the hospital, packed my hospital bags, and we left. So we got to the health center. That was where I used. I used the health center. We got there around 7:30 p.m. that evening. And mind you, all by this man was really restless and uncomfortable. All the while during the ride, the contractions were just coming. They would come and oh, it wasn't sweet. It wasn't sweet, but now I can now say it was bearable. But then I was like, this is unbearable. What is this? But I was still laughing, chatting. That's when the that's during the intervals between the contractions, I'll still be able to talk well, laugh well, do other things. But once it hits like this, what I was doing, I just grabbed the next thing close to me, whether it's a bed or it's somebody's hand, I just grab. My delivery was too fast. Like it was fast compared to the things I have. And prior to this time, I had read, remember, I thought I was in a forum. So I've read the stories of other mamas sharing their delivery. And sometimes I just ask myself, Apanga Gapa Jema, like, maybe I would do this. So when we got to the hospital by that time, 7:47 p.m. in the evening, that was when we arrived at the hospital. The way I was looking, because I didn't dress well, I wore my long top with my leggings. And we got to the hospital, the nurses looked at me, they say, well, I say that I'm having contractions. She now asked me, what else did you see? Because at that time I had not even seen what they call it, the bloody shoot. The water has not broken, nothing. All the signs that they told me, the only signs that I was having was that contractions, and then there was little mucus. I was taken into the delivery room, and when they checked my dilation progress, they said I wasn't even up to 2 cm dilated. We were asked to go home and come back the next morning because my dilation was still very far. Like I had not even gone halfway. And we lived in a very far place from the health center, and so we decided not to go, we decided to stay. And then they gave me a bed. So while we were there, few minutes later, like it wasn't even, everything just happened so fast. So I was lying down, there was no comfortable position, like not even up to 30 minutes after we were given a bed, I still having, like, this one was no longer contraction, like it was different. I started feeling a strong urge, like I wanted to poop. So I told one of the nurses, like, I want to poop. It's like I want to poop. And nurses did not take me seriously. They were like, people that came here before you, they are still here. You that you are just coming, they are disturbing. That I should wait. But I kept insisting because I knew what I was feeling inside of my body. I might not be a midwife or anything, but I had my body. I knew what I was feeling inside. So one of the nurses now came and they took me into the delivery ward. And this was when the drama now started. When we got there, she wore the long robe to check the dilation progress again, only for her to check, and then she gave a surprised look like, saw that the baby's head was crowning already. The baby had already engaged. She was surprised. This should be like few minutes after 8 p.m. So they started running up and down, bringing things. She quickly wore her something, that's something like apron anyway. Got called other people, they started getting things for the delivery ready, they rushed out, got my hospital bag. That pandemonium that happens in hospitals when there's an emergency. Not my case was not an emergency, just that I think the baby took us all by surprise, because by their calculations I was to give birth the following morning, not even in the next not as soon as that. One more, that experience, I'm not going to lie, it was painful. I'm not sure I felt that kind of pain in my life before. Oh God, I was shouting. I say, my auntie that was with me, she was telling me that I should sorry you, that baby is looking for road to come out. I was like, who block road for the baby? Who is blocking the road? Did anybody block your road, baby? So I was asked to push. I didn't even know how to push. Like my antenatal classes have not gotten to that week where they started telling us this is how you push or not push. I didn't even know how to push. I had to be telling I was crying, I had to be telling the nurse, I don't know how to do it. I say, hold your head leg like this, hold your hand like this, look at your stomach. No, no, no. We'll tell you when to push and all that and all that. So finally, I think that happened about 3 times, the pushing and all that. And before I knew it, when I even heard the cry of the baby, I just knew that I just like when you want to shit very strong shit. That's when you want to poop very strong poop. That was the feeling. And then when the baby even came out, like I was even surprised. I just heard wah wah. I noticed when she left my body because it was as if like the pain and everything. As her head just came out, the whole body just came out. Like, brrr. She started crying immediately. She started crying, and I felt a bit relieved. I felt a bit, in fact, I felt relieved. So that was how she came out. Though she came out to the glory of God, nothing missing, nothing broken, and all that. Second, if I'm going to have another baby, I don't think I'm going to use that health center because those nurses showed me shege. I'm not saying they are not nice people, they are good people, but I would not say that I enjoy their services up to 70%. Like they're professionals, but the empathy was not really there. Mind you, I was a first time mom. I was a first time mom, and I believe that there should have been a level of pamper, but the students were not there for it. I had 4 nurses attending to me in that labor ward. All the 4 of them were shouting on me at the same time. At the same, like, there was just this one say, push now. Like, I thought they were supposed to understand that I have not done this before. You're supposed to guide me through it. It was just one of the nurses that was even kind enough to like come down to my level and really explain things. Others were just like, push up. The main nurse Gongon that delivered the baby, she seemed so impatient. She was just stressing, repeating and repeating that she's tired though, that she needs to rest though, that she'll stay well though, that she needs to rest though. And my baby was 2.5 kg when she came out, and yet they gave me an episiotomy and episio. Anyway, they gave me a cut, so they gave me a tear. The baby was coming out, and somehow I feel that the tear wasn't necessary. I felt like it would have still be possible to bring baby out without necessarily having to cut me. But then the important thing is that the baby came out fine. The 2 months gone now, I've healed, even though sometimes I still feel a little bit of pain there. But then I felt like it could have been better. Like the tear was not necessary. My baby was really small when she came out. She really was. So time for the stitching. The stitching and the main labor pain. I don't even know which one is more painful because the stitching part, there was no anesthesia given to me. So the stitching part was really painful. I don't want to go through that again. That stitching part. I just thank God for the birthing experience, that baby was fine. I was fine. The only headache I had was that I couldn't stand well for days. Everywhere was just sore. So that was just it. Another one, my husband, everybody been praying for me. I didn't have the mantle. I had my mantle on my neck all the while. So that was my experience. That was my vetting experience. So how was yours? How was yours? How was yours? How was your vetting experience if you put to bed? So that night now they now moved me from the delivery ward, from the delivery room to the ward where you stay after delivery. My baby was really fair at birth. She was really fair. Even though now her skin tone has darkened. She took her dad's complexion. But it's okay. And she was really small. So the first time I carried her, when they brought her, I was just looking at her. Looking at her. She was just opening small eyes. Alright, so another headache was breastfeeding. Even though I didn't really have much issue with breastfeeding her, I lactated very well. Like from the hospital, they're still lactating. That night, I barely slept. So the rule of the health center, they don't allow your relatives to sleep over. So my auntie that was there to help my husband, they had to come home that night to come back the following morning. In my mind, I thought that okay, the nurses are here to help. Oh girl, help waiting. People that were just sleeping. They're there in the labor in the ward with us. Me and another lady that had also put to bed, they're just sleeping. So at night, I couldn't even sleep because finding a position to even lie down was work because of the pains that I was still feeling. Then we now start crying. I'll now have to struggle, sit up. I'll not carry her. I'll not. But she's a good girl. She learned to latch onto the breast very quickly. Anyway, I just thank God. I feel like this my story is just everywhere and nowhere. But then I thank God for a good delivery experience, and I just thank God. Just thank God. So thanks for listening to my story. So see you in my next video.